Established in 2004, the Spine and Brain Center of Eugene is a state-of-the-art neurosurgery practice with the training and expertise to surgically treat spine, brain, and neurological problems. Dr. Glenn Kuiper heads a caring, comprehensive staff specifically trained to deal with spine problems. A board-certified neurosurgeon proficient in minimally invasive techniques, Dr. Kuiper uses the latest, safest technology available to help ensure excellent success rates.
There are a couple things that make us unique. The way in which we deal with patients and the type of surgery that we do. Spine surgery has been in development for a long time, and spine surgery has not always restored a patient. Sometimes it's made the problem worse. This practice has the most outstanding results after surgery that I've ever seen. The patient comes in and is returned to work after 2 to 3 weeks rather than the several months that spine surgery recuperation used to take.
Our mission is to treat each patient individually. We'd like to tailor-make a state-of-the-art treatment program for each patient that'll fit their needs. Our mission also is to offer the least invasive treatment program. We start with rehabilitation, pain management, and if all of that fails, state-of-the-art surgical techniques.
Joanne Barrett had lived with chronic pain long enough. She tried physical therapy and many other medical treatments, but saw no marked improvement.
I tried heat, I tried ibuprofen, all of the normal things that I would treat my neck pain with. I tried for the back pain, but this time it did not get better. It got excruciating, and all of a sudden I couldn't walk or stand. So I went to my doctor, and she ordered an MRI, and it showed that I had a disc fragment that was broken off and sitting on my S1 nerve root, and she recommended that I go to see a neurosurgeon.
Joanne is not alone. Next to the common cold, back pain is the second most common reason patients visit their doctor. In fact, Americans spend over $50 billion each year on back pain, the leading cause of disability in Americans under the age of 45, and the third cause of disability in those older than 45.
Each disc in your back is actually part of a joint complex that links your sacrum to your cranium, and those discs wear out under the force of gravity. The more stressful you are with the spine, the sooner that they can wear out. We strive to help the patients get over their pain syndromes with their low back or their cervical spine with the least invasive principles first. Physical therapy, pain management, changing of their environment, change their body habitus. We do everything we can to help them avoid surgery. And if they fail to improve their pain condition or pain syndrome with our non-surgical techniques, then we resort to our state-of-the-art techniques that we have to offer here at the Spine and Brain Center.
A spine-specializing neurosurgeon, Dr. Glenn Kuiper is the founder and owner of the Spine and Brain Center of Eugene and the Spine Surgery Center, a nationally recognized expert in minimally invasive spine surgery techniques that achieve immediate results. These procedures can dramatically cut a patient's recuperation time and costs.
The most common condition that people have surgery for in the lumbar spine is a herniated disc. We can remove the herniated disc material with minimal invasion to the spine and the surrounding musculature. This allows them to recover faster and to have their surgery on an outpatient basis. The other technique which we've developed here is lumbar fusion on an outpatient basis. This requires special retractors and can be performed through as small as a 1-inch incision in a small patient. We can perform a 360-degree fusion through that incision with less than 100 cc's of blood loss, minimal trauma to the surrounding tissues, and a same-day surgery principle. In Joanne's case, she had a degenerative disc at L5-S1, and the remainder of her spine was perfectly normal and painless. We ended up performing a minimally invasive lumbar fusion on her using the techniques that we have to offer here on an outpatient basis.
Believing in treating the person, not the condition, Dr. Kuiper and his colleagues operate here in this state-of-the-art ambulatory surgery facility. Patients that undergo surgery are often discharged the same day, which translates into less of an economic impact to the patient and their insurance provider.
We try to offer them every level of care that they may need, from physical therapy to chronic pain management to possibly surgical intervention. And it can all be done out of one place. The patients become very comfortable with coming here, and whatever level of care they need, we try to provide it out of one center. We control the equipment we use, the implants if there's going to be an implant, the technique, the people we hire. We can demand a level of expertise, and then we can also help reach that by training our personnel, by being a part of the continuing growth of this.
I had my back surgery 10 weeks ago, and within a week, I was up and walking around and pain-free and started physical therapy 1 week after surgery. When I came down here for my 4-week post-op visit, I had no pain at all. Every single day I feel a little bit better, and I'm just very grateful every day. When I wake up, I can do more and more, everything I used to do.
We care very much about setting the gold standard, and that means adhering to all the recognized state-of-the-art standards for a surgery center. We are Medicare certified. We're AAAHC, which is the American Association of Ambulatory Healthcare Certification. We're also state licensed and approved, and our patient satisfaction surveys are outstanding. We try to customize the care to the individual and not look at the problem that they're coming to us for. We have 4 scrapbooks full of cards and letters and appreciation notes from patients because of the outstanding care. We look from the beginning to the end at how we can bring in state-of-the-art equipment, people who are trained specifically to deal with spine surgery, and then making sure that they're safe after the surgery. We call them after their surgery's over to make sure they're doing fine at home. Our rate of infections is considerably less than the national averages. In 2,000 surgeries, we've had 2 infections.
The patients that we treat in this practice come to us with a markedly impaired quality of life. And it's just a real pleasure and a joy when those patients come back 6 weeks to 3 months, 6 months after surgery, and they're back to doing what they wanted to do, and they can't believe that they didn't have this done 5 years ago. Our patients are doing well, and that's rewarding. That's why you go into medicine, because you can help.
I couldn't do the normal things that you do in a household or taking care of your family. I couldn't drive, couldn't get in the car and go long distances. And, you know, we have a very, very busy life. And now I can just do the normal things. And very soon after surgery. Dr. Kuiper is great. He really inspires confidence, and I never was worried that the surgery wouldn't work. As soon as I woke up, he said it went perfect, and I've been pain-free ever since. What Dr. Kuiper did was a miracle to me, and it gave me my life back. And I'm very grateful.
One of our goals here is to advance the field. We do this through teaching other surgeons how to perform minimally invasive techniques. We also are conducting research and developing new technologies to fuse the lumbar spine.
Well, it's just very gratifying to be able to help patients. It's very gratifying to see them come in pain, to see them frustrated and fearful because of the amount of money they're going to have to pay, and then to be able to work through that process with them and see them restored to natural life.
For safe, experienced, state-of-the-art spinal care, learn more about the Spine and Brain Center of Eugene today, setting the gold standard in neurosurgery. For more information, go to eugenespine.com or call 541-485-2357.